Have you ever heard of anal prolapse? When part of the rectum actually slips out through the anus. It sounds scary, but it's more common than most people realize. In this video, we'll break down what is anal prolapse, the types, partial versus complete, why it happens, who is at risk, and when you need to see a doctor. And before we dive in, a quick reminder. I see that more than 80% of viewers watch my videos but don't subscribe. If you find this useful, please like, share, and subscribe. Your support really motivates me to keep making healthy content that helps people. What is anal prolapse? Anal prolapse, also called rectal prolapse, happens when the rectum, the large part of your large intestine, slips outside through the anus. There are two main types, partial and complete prolapse. In partial prolapse, only the inner lining of the rectum pushes out. This is more common in children and mild cases. In complete prolapse, the entire wall of the rectum protrudes outside. This is more serious and usually happens in older adults. So why does rectal prolapse happen? The biggest cause is chronic straining, usually from constipation, repeated heavy lifting, or long-standing coughing. Over time, straining weakens the muscles and ligaments that hold the rectum in place. So, who are at risk? Number one is older age. As you age, pelvic muscles naturally weaken. Women after childbirth, pregnancy, and multiple vaginal deliveries stretch the pelvic floor. Chronic constipation or diarrhea. Constant pressure damages the rectal support. And some neurological problems like spinal cord injury or nerve damage can also increase the risk. So while it sounds unusual, anal prolapse is often the result of everyday habits, like ignoring constipation or straining too much. How do you know if you might have anal prolapse? You may notice a soft bulge coming out of the anus, especially after passing motion. There may be rectal bleeding, mucus discharge, or difficulty in controlling gas or motion. Some patients describe a feeling of something coming down during straining. Now, when should you consult a specialist? If you see or feel any bulge after passing stool, if there is repeated bleeding or mucus leakage, if you have constipation that isn't improving, or if the prolapse doesn't go back on its own. Remember, early treatment is always simpler. Ignoring it can make things worse over time. The treatment for rectal prolapse depends on its severity. In mild or partial prolapse, lifestyle changes like high fiber diet, hydration, and avoiding straining may help. For complete prolapse, surgery is usually required to repair and support the rectum. Prevention is the key. Manage constipation, strengthen your pelvic floor, and don't ignore the bowel issues. So now you know anal prolapse is not just about the age, but also about lifestyle, childbirth, and chronic straining. Recognizing symptoms early and consulting a doctor can make all the differences. And once again, I notice most of you watch but don't subscribe. If this video helped you, please like, share, and subscribe. Your small click helps me reach more people who may be quietly suffering with these issues. Stay healthy, stay informed. See you in my next video. Thank you.